Well, we're back right here on Hala Kuwait, and we apologize about any technical difficulties. We have moved to a new studio temporarily while we're getting things ready with our new studio. If you're just tuning in, our first guest we have this evening, Dr. Ahmad AlKhabaz, who is a consultant dealing with allergy, asthma, and immunology. Doctor, we'd like to welcome you to our program.
Thank you very much. Thank you for having me.
Pleasure to have you with us. First off, tell us a little bit about food allergies, sir.
Right. So food allergies, as you know, is a very common term. Like many people talk about having any trouble with food, and they say that's a food allergy.
It's very vast, I think.
It is very much. And most people think of food allergy as a result of eating food and having any problem with food. Sometimes people talk about gases and think that's food allergy. Some people talk about having, for example, cough, and they say that's food allergy as well. The food allergy we are worried about, which affects about, let's say, about 8%, 6 to 8% of people, especially in children, is the allergy where it's caused by antibodies in the blood that react to food proteins. And in their response to food proteins, you get like a fight. It's like a fight trying to fight something foreign. Basically, the immune system thinks food is an invader, like a bacteria or a virus. And this fight causes symptoms. And those are, for example, as simple as cough, sneeze, breathing difficulty, sometimes hives and rashes like urticaria, sometimes itchiness. As well, you can have sometimes very bad allergies, especially with nuts, where you can have...
with nuts, you said, doctor?
Especially with nuts.
Why is that with nuts?
They're traditionally known to cause a lot of severe allergies, especially nuts and sesame. And in that response, the body, you can have, for example, dropping your blood pressure, fainting, needing to go into hospital, and very rarely, in about let's say 2%, unfortunately, even death.
Okay, that's very severe in some of those very rare cases, but as you said, some of the allergies vary. Some of them very small symptoms. You may have a little cough and it just kind of goes away.
Yes.
Spicy foods can cause some allergies, doctor, temporary ones?
Yeah, you see, this is an interesting question, Tareq, because spicy food, lactose, and caffeine result in a lot of symptoms. For example, they can cause heartburn, they can cause diarrhea, they can cause stomach cramps, and they can cause indigestion. But these are not allergies. They're what we call intolerances. And the difference is that an intolerance is very dose dependent. Some people tolerate coffee like 1 cup a day. Like if I drink it at 5, I won't be able to sleep.
I'm the same like you. If I drink anything 5, 6 p.m. caffeine, that's it, I'm up all night.
So that's an intolerance, you see what I mean? And some people get gastric upset with caffeine as well. Some people get with lactose, which is the sugar in milk, get colic and gases, that's very common. But those cases are always specific just to the GI tract, meaning only affecting the esophagus and the stomach. And it doesn't affect you generally, like with allergies.
Well, thank you for clearing that up, doctor. So tell us now, how does the food that a pregnant mother eats affect the baby's health, sir?
That's an interesting question as well, because I have many mothers who are breastfeeding, and they come to the clinic and say, our child has eczema, which is basically kind of a skin allergy, and they say, could this be caused by the milk? And I say, yes. And they say, how come? They're only breastfeeding. It's only human milk. The fact is, the human mother's breast milk is actually having all the proteins of all the food that she eats. So basically, if she drinks something with milk protein, the child can have a milk protein allergy, a cow milk protein allergy. If they eat eggs, the child can have an egg allergy. And as well, if she eating fish or nuts or other vegetables, the allergy goes as proteins, small proteins inside the mother's milk and affect the baby. So that's when we test the baby. We test the baby for a lot of foods, and the parents are surprised because they say, how come you're testing for all this food but the baby's only drinking milk? And the answer is this: the mother's milk has all the food that the mother is eating already.
Does it also prevent allergy?
In fact, in some studies it can help, because the chance, for example, of cow milk protein allergy in children is about, let's say, between 2 and 3%, but it's actually less than 0.5% or 1% if you're only breastfeeding. So if you have early cow milk as a baby with a formula, for example, if you have other foods given to you at a later time and not having breastfeeding, that does increase your risk of having food allergies.
Tell us now, doctor, allergy problems in general are quite common between kids. Can you elaborate more on that, please?
Sure. you know what allergy is termed? Allergy is called the rich country syndrome.
Okay.
So basically, the richer you are, the more allergies you get.
The more abundant of things that you have then,
It's unfortunate, but it's true, because with modernization, we have a lot of antibiotics, we have a lot of artificial births, we have less and less breastfeeding, we have a lot of children who have, mothers have C-sections, we have a lot of artificial foods as well. We have delayed food given to the children. For example, if you start to feed the child after 6 months of age, that increases your risk of food allergy. While in other countries, and by recommendation of the allergy societies, giving babies food early at 4 months, even the allergy foods like nuts, shrimps, as well as tasting them, not giving them like a full dose, but tasting shrimp, fish, nuts, peanuts, and egg. By tasting at early age, around 4 to 6 months, that does reduce your risk of developing food allergies. So
builds up a tolerance to it later on?
It does help. It does help, not with all kids, but it does help.
Okay.
The problem is that allergies don't only affect you with foods, because if you have one chance of allergy, for example, with food, then you have a chance with allergy to eczema, which is a skin allergy, then a risk as you get older to asthma, which is a lung allergy, and then to a risk of rhinitis, conjunctivitis, and sinusitis as you get to be older. So it's a collective risk that you have. For example, if you have one parent who has one form of allergy, then you have a 30% chance in your child of having one form of allergy. Then if you have two parents, which is not uncommon in Kuwait, then you have about 50% to 60% chance of having an allergy in your child. And if you have two parents with the same allergy, for example, both parents having asthma, then the risk in their children is as high as 70 to 80% of having, for example, asthma. So
that number goes up drastically, huh?
Yes, the more you have parents with higher risk of allergy, the higher the chance of your children. It's only a chance, but it is a chance of your children having any form of allergy. And in fact, you can have maybe about 10 to 15% of children born to families who don't have any allergy at all, who just develop like what we call de novo, like a new development of allergy in a family where there's no history of allergy. So it can happen this way as well.
Doctor, you touched on asthma, I think 2 or 3 times in your answer right now. Can you tell us a little bit more about asthma, please?
Sure. So asthma, as people know it and parents know it, is a child or an adult who has cough, breathing difficulty, phlegm, and wet cough, sometimes wheezing as well, inability to play sports sometimes, sometimes coughing during sleep, and they require Ventolin, which is what we call
an inhaler.
It's an inhaler. It's a bronchodilator, which means it's a medication like Ventolin, for example, that will open up the airways and allow you to breathe. So it's a chronic condition that results in chronic inflammation of the airways. So meaning chronic means it goes in waxes and wanes. It doesn't go away completely in many people. So many children who have asthma symptoms can be as well adult asthma patients.
But there are also children that grow out of it also, correct, doctor? When
Absolutely.
You're a child, you can grow out of it.
Absolutely. In fact, the majority, Tareq, do outgrow the asthma by the time they're about 3 to 4 years of age, up to 2/3. So up to 60% of children outgrow it. But if that child had a very strong history, family history of asthma or allergy, if they had a food allergy, if they had eczema, if they had positive testing that shows allergy as well to the environment, their chance of outgrowing the allergy becomes less and less.
And asthma, does it come from like the surroundings also, doctor?
Right.
Some people they get it from hay fever,
Right.
dusty weather conditions.
Right.
Maybe humidity also can make the lungs
Sure.
go down a little bit. Tell us more about that.
Yeah, it's interesting you mentioned, Tareq, humidity, because humidity is a mixture of pollution that comes down. And in Kuwait, we know that we have a very high, unfortunately, pollution rate. And that comes down from the environment and residential areas next to polluted areas. So with humidity, all the pollution comes down and does affect the lungs and gives you asthma with pollution. But then you can have asthma with environmental allergens, and those could be something inside the house or outside the house. So inside the house, it could be, for example, the pets you have, a cat or a dog or a bird. Or it could be outside if you like, horseback riding, or have any cattle, you can have allergy to those as well, and wool. But then in the environment you have as well house dust mite, you have mold which comes from plants, and you have as well a lot of pollen. So a lot of the trees in Kuwait that are planted pollinate different times of the year, and those, when they come, and certain people who have allergies to those pollens, they inhale and gets their eyes allergies, their nose allergies, their sinus allergies, and they get
eyes watery and
exactly.
their nose running.
Yeah, and it's a peak season actually in September in Kuwait as well. So many people suffer during September, as much as we call it a September pandemic, which is like it's not a COVID pandemic, but it's an allergy pandemic all over the world that usually hits people mostly in September as well.
And are some of these allergies, doctor, can you actually test for allergies? There's like a pricking test that you do.
Yes.
Tell us more in detail about this, sir.
Absolutely, absolutely. So the allergy test, Tareq, is meant to help, not to diagnose the asthma or the allergy by itself. So the most important thing is the doctor's opinion. The allergy test can be done from early age, as early as 2 or 3 months of age, and they have to be done by an expert allergist who has the training to read the testing, whether they are blood tests or skin test. Now, you'd be surprised if I ask you, is skin test better or blood test better? What do you think?
Well, doctor, I think the skin test, in my opinion, is
okay, so you're very well educated.
I try to read up on things.
Thank you very much. So I'm glad to hear that from you, because most people think blood test is more accurate, but in fact it's not. Blood test has a role for sure, but it tends to test for a lot of things with one blood sample or two. The prick test is done on the skin, and it's limited with numbers sometimes, but it tends to be more accurate, meaning if you show a positive test, then it's most likely the cause of your allergy. But with a blood test, sometimes you get some numbers which are not always correct. So the skin test is done by applying drops of the food or for example, the inhalant item. It could be something from the cat or from pollen or milk protein or egg protein, applied to the arm of the child or the adult, and then pricked from the outside. A fairly simple procedure with little pain, maybe discomfort, with no blood. Then you read the results within about 20 minutes. And the measure on the skin is about swelling. So the more swelling you get, the more the allergy reaction would mean.
Okay.
Yes.
Well, very good information, doctor. We're appreciating your time with us. We know you have a very busy schedule, and we thank you for your time. Tell us a little bit now about some other things that you'd like to touch on before we end tonight's interview.
Sure. So we touched a little bit, but I think people have to be aware that, in September, Kuwait allergy season, the pollen allergy season, it peaks between March and June, and between August and October, November. So if they have any allergy medication, they should go on prophylaxis medication to prevent them from getting sick. Regarding the food allergy, a very, very important message: do not trust nuts, because nuts can change. You can have sometimes very small reaction, and as you get older, the reaction can get even worse and worse and worse. So they should always have a proper diagnosis, and it's about education and awareness. It's like your job, Tareq. You educate people. And for the allergy doctor, we need to educate people as well. So people, parents, family should be educated. They should not test the children allergies by themselves by giving them the food to test by mouth, because they can cause a very severe reaction. So they should go with a specialist doctor, do the proper testing, have the proper documentation, educate the schools about the allergies, educate the family, as well as carry EpiPens or adrenaline auto-injectors, which are pens to be used in case of emergency. So basically, if the child having a very bad reaction with a food allergy by mistake, especially with a restaurant, the parent can give the injection to the child immediately and actually save their lives, and then go to the hospital. So the message is really to be aware, be educated, and go to the right people and do the right testing as well.
Well, we really appreciate your time, Doctor. Very informative interview. We appreciate your time with us this evening.
Thank you very much.
Thank you very much. We'd like to thank our distinguished doctor, Dr. Ahmad AlKhabaz, consultant dealing with allergy, asthma, and immunology, for his time with us right here on Hala Kuwait. Right now we're going to move on to another one of our amazing reports. Stay tuned.